Another question that I was asked during a new graduate RN interview was to share how I would handle a situation in which I disagreed with a doctor's order set. I don't love this question because I feel like as a new grad, you don't have a ton of experience working with doctors or even understanding order sets, let alone disagreeing with them. But they just want to see how you're going to handle that conflict. Also, a little disclaimer, when I share these questions and my previous answers, I'm not telling you to copy my exact answer. This is purely just to give you something to think about, maybe a different perspective. Maybe it'll remind you of other situations that you have encountered that you can draw from in order to answer this question on your own. I said something along the lines of, as a new grad RN, I don't think that I have really encountered a situation I have noticed is that there have been many order sets that I have found that I just simply don't understand quite yet. Now, for me personally, I don't feel safe implementing interventions or order sets that I don't understand. So the way I would handle this situation is by approaching the doctor at the appropriate time when we both have a minute to talk and explaining to them that I am on the newer side and I'm struggling to understand how this order is helping our patient. I would then ask them if they had a moment to teach me so I could better understand the order set and the relevance. Most providers are going to want to teach you. If for whatever reason I approached a doctor in this manner and they truly would not give me the time of day, that's where I would explain that at that point, I would go to my resource nurse, I would go to my charge nurse or my manager if I had to. I would go up the chain of command to make sure that I was following order sets in a safe and appropriate way. So I did kind of ramble on with that, but essentially you just want to focus on open, clear, and respectful communication. And you want to focus on approaching the doctor and not judging their order set or questioning their knowledge. Instead, approach it in a way of, can you please teach me so I can better understand? And focus on collaboration for the best patient care possible.